Welcome, everyone, to the show. It is season 3. We are back. This is the Healthcare Inspired podcast. As you saw on your screens, and as you've probably seen all over, we have a new season, The Connected Leader. I want to welcome back to the show my amazing co-host, Maya Turner. Welcome back to the show, Maya.
Hello. It's so good to see your beautiful face. It's so good to be
Yours
back
too,
on.
lady.
I know.
I'm so excited to see you and to see what we can, of course, scrounge up today, right? No, we've got a planned
Oh,
show. We've got a planned show. We've got good stuff today. And I know I've gotten a lot of questions. People have been asking me what I've been up to because I have been somewhat MIA off and on for the last few weeks. And I know some of you know I was on this crazy 3-week road trip with my husband. I left HealthCon and I never looked back. I went around the country and I got home last Thursday trying to catch up on work and trying to catch up on emails, see what happened while I was gone. And I was able to keep up a little bit on LinkedIn and keep up a little bit with what's going on in the industry, but I really enjoyed my time going to wineries and seeing the states of I'm going to tell you this is how many states I went to. I visited Nevada, I visited
wow.
California, Oregon, Washington, Idaho, Montana, Wyoming, South Dakota, and then I went back down home through Nebraska. I think we hit Iowa at one point, Kansas. We hit Arkansas, Missouri. Yeah. I don't even know how many
Wow. So
states I
you
hit.
went from the West Coast and then you kind of traveled, but you didn't take Route 66 though.
Yeah, I know, right? Then the old days, that was the way you got around, right? Well, no, I mean,
Yeah.
we took I-40 out, right? We hit Vegas.
Yeah.
That was the first part, right? HealthCon was amazing. We'll talk about that. And then
Yeah.
after HealthCon, it was our 20-year anniversary trip. We decided to make fabulous. I told my husband, people asking me, like, what was your favorite part? And I keep going back to Oregon. I just fell in love with the state of Oregon. Maybe it's because we were on the coast the whole time and I love the coast. I love the coast even northern because of the way the water hits the rocks. You know, it's just there's something
Oh,
about it. I just don't even know.
yeah. So you're a water calms you? Are you
Mm,
yeah, yeah,
yes.
yeah.
I'll have to send you all a picture of the photo I took outside my window. We got this really cute hotel in right on the water in Oregon and in Newport, Oregon. It was so cute. And woke up in the morning. We have a sliding glass door. We actually see the ocean from our room. And so I went out there with my coffee, and there was a little bird out there just having coffee with me. So it was so
Oh,
peaceful and enjoyable. I got to hit some things off my bucket list. I got to see Astoria, Oregon, got pictures with the Goonie stuff and the school where they filmed Kindergarten Cop, like the 80s and 90s girl in me was
was that it?
yeah,
Oh, really?
yeah, yeah,
It's
it
not a
was.
tumor.
Exactly. I love it so much. You and me with our movies, we just love it. This is why I love you, Maya, because we can have these conversations and be all like, fun, and then we can get into healthcare and talk about serious stuff.
Oh yeah. Oh yeah. Oh yeah. Oh yeah.
Which we will
That's
get
very
into,
cool.
guys. We'll get into that.
Yeah.
But HealthCon this year was very special.
Yeah.
This year for me, it was my fifth time speaking in a row at HealthCon. I was like, "What is
Nice.
happening?" Hit number
Right.
5. It was exciting, and I'm bummed that they put us against each other at the same hour of the day. So what are you gonna
I
do?
know.
I wanted to see yours, and but let me ask you, how did your presentation go? What did you have any great responses or questions that you got?
Yeah, I spoke on a topic that I speak of often, which is observation and the escalation of care, and making the connection of the very topic of communicating through the medical record. Clinicians and physicians alike fail to note conversations that make that much of a difference. And I got a pretty good scores. And I think when you're speaking of different things, you always got to add a different twist. And I always like to encourage people to go outside the box and things. So it was really good. I had a really good response. I thought it was very productive and motivational for a lot of people who were there.
That's so great. I was able to speak on compliance for remote and hybrid teams, and it was a topic that just it came to me because I'm already everything about my world is compliance. And so I always tell people I am first and foremost a compliance consultant, but everything else fits in around it. Like everything else I do is all based on compliance. And so I thought it was a good topic, and it was more well received than I had expected because I realized how many people would be interested in it. It was a really a great attendance and a lot of good questions. We just had fun, and that's what I love about speaking live in person because you can really just engage with people. You can see their
Hmm.
faces, right? How they
Hmm.
react to what you're saying, and you
Yeah,
can
yeah, yeah,
focus
yeah.
on one person, right? And you can see how they're reacting, right? So it's great.
Hmm. 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 Yeah, yeah. I think a lot of times when we're I think because we're now really beginning to realize that COVID is over, right? And now we're beginning to get back to the uh the necessity to be in person, the tangibility of having that real conversation where you can actually touch someone and laugh and take pictures of them in the same space like we did at HealthCon. So,
Yes.
I think that's important. I'm actually I'm scheduled to speak at Orange Irvine, the local chapter. I'm going there in person because, yeah,
Ah!
I'm going there in person because I told lady who's she's just an amazing person. She's the reason why we're connected, right? And
Absolutely.
she invited me out, and I said, you know what, I'm coming. I gotta come. And they were like, oh my gosh, you're coming. And I'm like, I think it's just time that we just all just get over ourselves and begin to start meeting in person and start realizing how important it is to be in person and those tangible hugs, those conversations that you can't have in the camera all the time. You could just talk to them and sneak away and have that conversation. So I think all of that is
Mhm.
important. And I think it's time for us to bring it back. Let's come back. Let's start doing meetings in person again. I'm actually going
Absolutely.
to Atlanta too, so in September. So I think it's important that we bring all that stuff back. I can't stress that enough.
Absolutely. And I really appreciate the chapters who encourage that. And, last night I got to speak on the revenue cycle, compliance, and revenue integrity. And their meeting was all in person. So I was the only one not there. So it was really cool to hear. And one of the girls, so it was interesting at HealthCon. I remember this, they reminded me of the importance of being part of the AAPC's mentorship program. I
Yeah,
was a part of it, a few years ago, and, then I
it
just
was called
wasn't able
Project
to.
Extern, though, right? Wasn't it
There was
called
that,
called?
there was that, yes, I did do that, but then there's another one that is just mentorship. So it's
Okay,
mentoring someone who needs a mentor, right? And so they were mentioning that in one of the panels, and it reminded me that I had signed up a while ago, but it was my another email that I don't have anymore. And so I was like, "Oh, I need to go back in there. That reminds me, I really wanna do that again." I'm in a place in my life
right,
where I feel like I wanna give back more and more. So I
right.
signed up right after HealthCon,
Yeah, yeah, yeah.
and I have 2 new mentees that joined, and one of them belongs to the chapter that I spoke at last night, and so she was so excited.
Oh
Well, she's like, I want when you come, I'm gonna give you a big hug." And so I had to let her down gently that I wasn't gonna be there in person, and I felt
wow.
so bad. And so I was like, that's the thing. It's like people really want to be people. A
Yeah,
lot of them do, right? So
yeah,
I'm telling
yeah,
you,
yeah,
chapters out there, if at all possible, I am willing to support your chapter. If we can make it happen, I will come in person. Let's
yeah.
talk it out. Let's figure out a way to do that. I actually have a free plane ticket sitting there because I was supposed to go to Florida to a chapter and it was canceled. So now I have a free plane ticket, guys. So if you want me to come in person, just ring me up. Let's figure out who is the next in line that wants me to come in person. We'll make it happen. I am going in
Right.
person to Knoxville next weekend for their May Mania.
Knoxville, Tennessee.
Yeah, I'll be there for their
Yeah,
May
and I'm speaking
Mania.
for May Mania too for next
Yeah,
week in California. Yep.
next week. Okay, so you'll be on the West Coast. I will be technically, I guess it's East Coast time for some reason.
Yeah,
Knoxville's East
yeah, yeah, yeah.
time. So I'll be on the East Coast time, but I'm excited to be there in Knoxville. I love Knoxville. My best friend lives there, so it's kind of a fun
Wow.
little excursion. We get to see our best friends, go to dinner,
Right.
celebrate our
Yeah.
anniversaries
Yeah. Yeah.
together.
Yeah.
So
Yeah. It's
it's
a
gonna be a good
reason to see your friends. You know, you might as
yeah,
well have some,
yeah,
it's a reason. It's a reason. Yeah, I think that's
absolutely,
so important. Yeah. We gotta
absolutely.
bring back the importance of connecting with our friends. Because COVID is over, people aren't scared as much anymore, and we need to just connect, period. So yeah.
100%, 100%. So when I think about all of the things that we deal with in healthcare, one of the things, and of course it goes along with our topic for today and for this whole
Mhm.
entire season, is that we need to be more connected to
Yeah.
people.
Yeah.
We're going to talk about connected leaders, but we need that connection. We need to be in touch and in tune with what's going on, not only in the industry, but with people that we interact with all day long, and those that we might
Absolutely.
not interact with every day, but that we do interact
Hmm.
with at Walmart or we go, to Target, wherever
Yes.
we're going. Be people. So we'll talk about
Yeah.
that at some point
Yes.
during this season. But we have a new segment, guys, and I announced it briefly on LinkedIn. What would you do? Do you guys remember on Nickelodeon when you were kids, the show What Would You Do?
Yes.
All of a sudden it hit me.
Yes.
I'm like, that was a show, right? When we were kids.
Yes.
Um, little crazy stuff you would do. Well, this time our segment is not, we're going to not have you do crazy stunts on the show. We're going to have you listen as we dissect a question that we
Hmm.
get from a client or someone that just reaches out to us, say, hey, I'm having this problem. I'm stuck and I don't know what to do. And sometimes it's
Hmm.
a coding question. Sometimes it's just, I experienced this and I don't know how to handle it.
Right.
Right. I don't know
Yeah.
where to
Yeah.
go from here.
Right.
So,
And I think a lot of
yeah.
having that piece where you can always bounce off the opinion of someone else kind of lets you know that you're in the right space. Maybe not exactly the same action, but at least in the right space. So your moral and ethical reaction seems to be in line with what people would expect.
Absolutely. And so we know that this show is live right now. It's also going to be recorded. And those of you listening, of course, to the audio version are going to enjoy the content. But let's get right to this question that I got. So we know that we interact with physicians all day long, sometimes in our jobs, or maybe we interact with them, maybe we're just doing education. But sometimes there are physicians out there that don't agree with us. And there's nothing wrong with having an educated conversation. And I
Absolutely.
use and I use the word educated very strongly,
Yes. Yes.
okay?
Yeah. So
Yeah,
we in compliance and in training and audits for baselines and all of that, factual conversations, fact-based conversations and actions behind that makes a difference on the outcome. Does physicians smell
100%,
fear?
100%. So before I answer this question, I want you guys to take a look. I'm posting this link in LinkedIn so everyone can see it in the comments. This is the link I'm going to be referring to. It's from the OIG, the Office of Inspector General, on the fraud and
Mhm.
abuse laws. Okay. So we get questions from physicians, we questions from coders. This is actually a consultant that reached out to me because she was having a conundrum with a physician. And we've all worked for different types of physicians, different types of office managers we've dealt with, compliance people, and they don't always agree. And maybe they don't always know about a law that exists or a rule out there that affects the way
Mhm.
they conduct business. So I always like to go back to this is the regulation. So last night in my presentation, I talked about CMS, the Centers for Medicare and Medicaid Services. I talked about the OIG, the Office of
Mhm.
Inspector General, and then our private payers, the ones that pay the bill and the ones that govern the federal payers that help manage those programs. Those are our regulatory agencies
Yes.
um, that
Mhm.
regulate the guidelines. And there are others as well, but those are the three that I picked to choose or chose to pick and talk about last night. But here's what that link states. If you go under all the way down to the civil monetary penalties law, I want to read this to you, okay? It says the OIG may seek civil monetary penalties and sometimes exclusion for a wide variety of conduct and is authorized to seek different amounts of penalties and assessments based on the type of violation at issue. Penalties range from $10,000 to
Mhm.
$50,000 per
Per
violation.
Yeah. Yeah.
Okay. So,
Mhm.
what are some examples? Well, they give us some examples. What could this include? Presenting a claim that a person knows or should know is for an item or service that was not provided as claimed or is false or fraudulent. The key there is not provided as claimed. What happens when we look at a claim, right? A physician sends it to us, and her question was, how do I express to this physician that they want me to bill this regardless? They said, please bill it as I've indicated. And there is an issue because what they're asking to bill, part of it's bundled and you can't unbundle with a modifier. We looked it up. There's clearly no way to bypass a modifier. It's all red. You punch it in your encoder. It's all red, right? We know that color red means no go, right? And the
Mhm.
indicator, of course, indicates that there's no modifier that can bypass it. And there's also evidence that what they're asking them to bill wasn't documented. And so you have options. This is true. And
Mhm.
so she did suggest those options to the physician based on what is documented. This is what we can get. But they're like, no, we want this code. Well, that's great. But how do you have those conversations? I'm going to just keep going on the list here. Presenting a claim that the person knows or should know is for an item or service which payment may not be made. So you know what happens when you're like, "Oh, let's just bill it anyway and see what happens?" That's a violation of that right there
Intentional.
because it's intentional. You know
Yeah,
that it's not payable because the policy states we
it's
don't
intentional.
cover it that way.
And that is fraud. Yep.
I can't
Mhm.
unsee it. It's right there in black and white. I it's there, right? Here's another one. Violating Medicare physician agreement. The physician also agrees
Conditions of
to
participation.
exactly. The last one. There's a little more, but the last one, making false statements or misrepresentations on applications or contracts to participate in the federal healthcare program. I also see issues with that because I see a lot of things where they do try to misrepresent themselves, and when we get into a lot of
Mhm.
lawsuits. So those are the areas of that particular CMP that I like to point out that really affect us as coders and maybe billers and credentialing specialists, auditors all the time because
Yeah.
we're having to look at these things, right? Um, there's other things in that have more to do with the clinical side, which obviously need to be addressed. But as far as those on the business side, those are the ones that I see. There's also violating the anti-kickback statute. So we're
Right.
always looking at advising them on their regulations for, their the what do you call it? Their agreements and
All
their
right.
vendor
Okay.
relationships, the relationships they
Right.
have, right?
Right.
So
Stark and
though
any kickback. Yeah. Mhm. Yep.
yes, their agreements, their vendors, the things that people that they deal with every day that they have agreements with.
Yeah.
And it's all about
Mhm.
protecting the Medicare program, the integrity of the
Mhm.
program. So when people contact me like that, I have a standard disclaimer. This is not to be taken as legal professional advice. I'm not a lawyer, but I'm going to point you to this article and you can show this to them and advise them that as an individual, first I said, look at your contract, right? Look at your
Yep.
contract that you signed with this physician or group. Did it indicate that you have rights as well? And you have the right to refuse to violate these laws yourself by not doing what they're asking you to do. And even if
Right.
you work in a coding role in a hospital where you're employed, you also have the right to refuse that. And if you are penalized in some way, you can report that as well because you should not be
Mhm.
penalized
Retaliation.
as
Mhm.
retaliation is not a thing you can expect. If it happens, you have rights, right?
Yes.
So you need to
Yeah.
make sure you follow through on that. Don't be afraid you're going to lose your job because you're doing what's right. You can seek help for
Yeah.
things like this if
Yeah.
this happens to you.
Mhm. Yep. Yep. I also think that and we talked about this on the coding cheerleader about covering your advice.
Yes.
In the words of Kim, That's not what I
Mhm.
would say. But I think that when we look at also in the OIG guidelines, it also specifies, and we talked about this, that in the event that uh, there needs to be clarification on a method of approach, and you call your Medicare administrative contractor, you have to write and date those things that they have advised if it was questionable. But if it's obviously a violation and you have advised that this is something that is not appropriate, this goes against coding regulations or what have you, I think it's important that you also write and date and what you advised in the article and get it in writing via the email.
Mhm.
And if it's advised and you have the response to do it anyway, you cover that, but you also are covering yourself, stating that you are advising that this is incorrect and you are advising that this method of approach is inappropriate based upon what you know as a coder and goes against your ethics. So I think all of that is very, very important when it comes to ethical and moral standards and abiding by compliance.
Absolutely, because we know we're in a time where it's constantly in our face. People
Hmm.
these days, even in healthcare, we're seeing there's no end to the amount of cases. Betty Hovey and Sunal Patel
Yeah.
have their
Yeah.
Friday
Compliance
fraudsters,
capers. Yeah.
the compliance capers. Yeah, that's it. Which you should listen to, guys, on Fridays. You should
Yeah.
be
It's
listening
really
to
good.
that. You
It's
really
really
should.
good.
And so, yeah, I mean, they dissect a case, and it's like they're unending, right? I just saw another one pop in today. Another case of incident 2 trying to use the supervision rules incorrectly. And I just did an audit for a private practice that a payer was taking money back, and they didn't know, I guess, didn't realize the policy for this particular payer did not allow for a nurse practitioner, APRN, any of those non-physician practitioners to provide incident 2 services. And of course, sometimes we can appeal to these payers, but a lot of times they're going to come back and say you should have known because we had a policy on it. And
You
that's
should
what
know
we
your
try to
contract.
avoid. Yeah.
Know your payer contracts. I can't, man, if it was so, okay, I'm trying to get off my soapbox, Jen, because you know me. I think it's important that we understand payer mix, right? We have to understand the payer mix and the difference between rules and regulations for federal and state payers versus commercial. Because when you're dealing with third party payers and you're dealing with commercial payers, they may fall under different guidelines than that of federal and state. And you need to understand the differences between the two and the contracts associated with. If you don't know and you're part of the compliance team, or if you're part of the auditing process for that, one, you need to be well aware of the payer policies and make yourself available to research what is not understood if it's misunderstood. Because if you don't, you're going to find yourself in a situation where you're constantly defending the situation because someone didn't take the time to read the contract. And you will be surprised about how things could be avoided if you simply understood the contract regulations. I can't stress
Exactly.
it
Yeah.
enough.
Exactly. So last night in the webinar I gave on revenue integrity, I had like a little slide there on tips for appeals. And before you even start to appeal a denial, you need to do your research. You need to know in and out what that policy stated, because you don't want to try to appeal something that you have no reason to appeal. And you're going to look like an idiot, excuse my language, just you're looking at an
Woo!
idiot to the payer, right? Like, what are you talking
Yeah,
about? The policy's right here. You violated it. And
yeah,
you
yeah, yeah.
appeal it based on information that you didn't have a full picture on. So again, don't go into a situation like this thinking you're big and bad and you have the answers when you don't. You don't know
Right.
what the policy states. You don't have any idea because you didn't read it. So there's
Mm-hmm.
that. But to protect yourself, when you go into a contract with a provider as a maybe a business consultant, make sure your contract states clearly your position, and then be willing to walk away if it's going to affect your reputation and your business. if you are an employee, be ready to walk away, have integrity, because you can do better. I
Yeah,
promise
yeah,
you. Okay.
yeah. And I,
Just,
yeah, and I've seen. I'm sorry, I didn't mean to cut you off.
you're
I
good.
was
You're
going to
good.
say that. I was going to say that, and I almost cringe that providers will. I won't say providers. Client people are willing to take clients that are unethical in their approach because it's client specific. There is no such thing as client specific if it goes against rules and regulations, period. Because if the Yates memo ever showed its face and be prominent in approach again, regardless, you will still be held accountable. And if they say, well, the client wants us to do this, and you know with all your being that that's incorrect, I can't do this project anymore. Can you put me on another project? Or it's been great working with you. I can't do this anymore. And because you are a coder and you're knowledgeable and you're a proven leader in your abilities, you can walk away and easily get something else.
Exactly. And there's always whistleblowing. So, make a good living on that one these days. Well, here we go, guys. We're going to get into our topic after we answered that amazing what would you do question. So, let's get into leadership, guys. This season is about the connected leader. And we're going to
Yes.
start it out today just talking about the foundations of leadership. Now, first and foremost, everyone out there who acts like a leader is a leader, regardless if you own your own company and you're like the CEO, or if you are a manager, a supervisor, a course administration. Even if you don't lead a team, you are still a leader because that is how you portray yourself.
Mm,
And I think we forget that concept because a
yeah.
manager is not a leader. A manager has tasks and things that have to get done, but a leader inspires and is someone that people will follow, regardless of what their manager is doing.
Yes.
So,
Yes. I Jennifer, that's probably why we were destined to have this co-hosting relationship. And we talk all the time. But I have said a million times over, you do not need a title to be a leader. A leader is your demonstrated ability to make sound decisions that people agree with and will seek your advice about, period. And because we are proven leaders in the industry and we've got certification to prove that we understand what we're doing, then we should be sought after because we have proven that we are leaders in our industry because we are certified, because you are a CPMA, because you're a cardiovascular coder, because you're a compliance expert. All of those things make a difference. And if people seek your advice about something, that means that you are a leader in that subject matter and can be trusted, period, once an advice has been given. And I think that's really important to understand. Even there's always the leader in the home, right? Where the one who always settles the arguments, the peacekeepers they call them. Well, if you're the leader in your home because you keep the peace, then guess what? That's your title when it comes to arguments. Get the peacekeeper, bring him in. It's time. Everybody's ready to fight. What do they say? And again, when that happens, that puts the situation at ease because they're looking for that person to resolve the issue. So we gotta give ourselves more credit. And I don't think we do. And we're looking for validation in the wrong places when it comes to leadership. Leadership is leadership is leadership. Management does not equal leadership.
mm-hmm.
Leadership is the proven ability to be trusted in a subject matter and give advice, and it is proven that it's worth it.
Absolutely. Well, here is what I found as a definition of some of the qualities that would highlight true leadership. Someone who has strong communication skills, has a strategic vision, adaptable to change, right?
Mm-hmm, mm-hmm, mm-hmm,
Empathetic,
mm-hmm,
has integrity, and a
mm-hmm.
focus on collaboration and team building.
Yes.
How many of you know managers that fit that description? Now, a lot of them do.
Yeah.
I'm not saying that they
A
don't.
lot of them do.
I
Mine
was
do.
a manager once, and I really tried to be this way. But it had managers that weren't this way. They didn't
Yeah.
have the ability to do this. And there are some managers that are really timid and they don't know how to speak up when things are maybe not right because they're not sure how to respond and they don't have a vision. They don't have sometimes, unfortunately, I'm sorry, they don't have empathy for people. They can't look at an employee who has these problems at home and if they have to go pick up their kid at 3 o'clock or they have these situations, they're not able to adapt to the changing times that employees
Right.
have these days. They don't have the empathy. They don't focus on team building and they have this huge turnover in their office and they wonder why.
Yeah. 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 I also think that um, leaders does those are, and what you mentioned are some characteristics, but there are times, because we talked about this on the different types of leaders. There are times when you have to be more than one type of leader
Yeah.
for a team. But you have to know when that type of leadership comes into play. You have the strong umbrella, but then you have to know when the type of management that is required for that type of employee or that type of team member. And you have to understand that the ability to adapt to those different types of employees creates loyalty because they are understood. And once they're understood, they will follow, they will always be willing to go above and beyond because you've proven that you would go above and beyond for them. So, absolutely.
Mhm.
I totally
Absolutely.
agree with that. Yeah.
Yeah, and we have situations where maybe a manager or director doesn't have the same experience level as you in a certain matter because they're not a certified coder. They didn't go to school for that. They went to school to manage or to maybe they know budgets really well. They know how to maybe be effective with communication, but then there is the fact where they have to lose their pride a little bit and realize that when their coders tell them we can't do this,
Hmm.
we can't do it. And we have to
Right.
listen to those that know the laws. Now, maybe it's an opportunity where we're just so busy and we don't have time to do this and this and this, but we can rely on our teams and assign some of those tasks. Now, there's a thing called,
Delegation.
delegation, right? Not micromanaging, right? You can't do it all. I'm sorry, managers, you can't do it all. You have to delegate and trust your teams to get it done. They will report back to you. This is what we found. They
Trust.
will show you proof positive that what they're telling you is from an actual regulation. They're not making it up. It's going to affect you later if you don't listen to them. So
Yes.
that is a true thing that's happening.
Yes.
Communication, of course, you have to, first of all, to communicate effectively, you have to have several things. You have to really know what the vision of that organization is. You
Hmm.
need to know what everyone does that contributes to that vision. And then you need to communicate regularly and make sure you know how everyone is carrying out that vision.
Hmm. Agree. 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 I also think that communication requires understanding on both sides.
Absolutely.
You can't communicate with someone and expect a result if they don't understand. It has to be clear understanding, and then if there's not understanding about the expectation, and that's where that training comes in. And once that happens, you create and you establish trust. So communication, trust, and all of that kind of makes a difference in your leadership ability and how the expectation of what's needed is understood.
Absolutely. And we have different kinds of, management roles in the industries. We have those that manage a small group of people. And then
Yeah.
up from there, you have the larger management teams that have to manage outwards, right? And
Yeah.
sometimes
Yeah.
they're getting told directions from higher than them, and they're trying to get that down to the different levels, and it may not be well received or maybe
Right.
understood
Hmm.
why that
Hmm.
direction is being given.
Right.
And so it may be a case where you have to explain a little more why this direction's been given, without giving away too much information that is not necessary for them to know at that point in time. Give them
Right.
enough so they can do their jobs and understand why the direction's been given.
Right. Right.
It's,
Right.
you got to do it.
Right. And, and I was just gonna say, I think when you're put in a position to provide education, or even if you're a manager of one, like you're the manager of a delegated area, but you still have to communicate with the people that you work with. So again, when I talk about communication and when we say communication, that means that whatever I'm saying and whatever I have to say has to be reached to another person and be understood about what the commonality and what that vision is, or what the end result should be when you are in a situation and you're sought after as the subject matter expert or the leader related to that specific topic. And you just got to be very mindful of the approach, because education is also different. The way people receive things is different. But when you're able to make that clear dotted line of what's the expectation is after the conversation, then you have effectively communicated and demonstrated yourself to be a proven leader.
Exactly. And every employee is different too. They're going to have different ways they do things. It doesn't mean it's wrong. You
Right,
don't have to push your way of doing things on someone because you feel it's the better way to do it. But
right,
you can advise them and give them examples of how doing things this way could be more beneficial. But at the end of the day, let them do it as long as the work gets done and it gets done correctly, and hopefully efficiently and doesn't waste too much time.
right,
We want to make sure we're being efficient and not wasting resources. But if you can let those things go, let them go. Don't harp on them. Don't make them feel
right,
like you're always out to get them. Make them feel
right.
like you are their ally, that you're there to help them and assist them when needed.
I think leadership is not about being rigid. Leadership is about flexibility and ability to
Flexibility.
adapt.
Yes. Flexibility. We got to be flexible. So throughout this season, we're going to talk more about leadership. We're going to talk about various areas that leaders have a hard time with.
Yeah,
And we're going to break apart. Let's talk about it. We're going to break apart compliance, guys. Leadership is about being compliant, because in order to be a true leader, you have to be able to show others that are following you that you're doing things the right way. Because if you're following someone, you're going to follow their footsteps because you're going
mhm,
where they're going. If
right,
your leader is going off over here and violating compliance standards, they're not a leader anymore because they're leading you
right,
down the wrong path.
right,
So
right,
that is not a good way to be, not a good path to follow. A true leader is going to lead you in a path that's going to be beneficial, not only for
right,
you, but for the organization and
right.
in life. So
Yeah.
follow the leaders, follow the leader, follow the leaders that lead you in the right path. And so we're going to break apart the compliance manual that we got back last year from the OIG. We're going to break apart different parts of it. We're going to talk about the 7 elements of the effective compliance program, throughout the season, sprinkled in to our discussions and how that helps us be effective leaders. We're going to have some
Yeah.
excellent guests on the show. We already have some lined up for some software vendors. They're going to talk about how technology is changing the face of leadership, how technology is changing the face of healthcare. We're going to talk about compliance in those methods. We're going to talk to actual leaders, who not only are being leaders without a title of management, but who are being leaders in general. And maybe that concept of being a leader before they were in a position of management help them attain
Yeah.
that
Yes.
role.
Yes. Yeah, and
So,
even in addition to that, we have our accrediting body, the AAPC, who has
mhm,
the leadership program. And I think
yes,
it's important to understand that when you're involved with that type of program, it molds you to be a leader. It molds you to take the stance when you need it. But again, I won't say that you necessarily need that to be a leader, but to be effective and leaders in the healthcare industry, there are certain traits that you have to take on. Understanding compliance, the subject matters, and things of that nature. And those are the types of venues, specifically with the AAPC, to help you in that manner, to move you forward so that you could be the subject matter expert and the leader that you need to be for that given time when it's called or when it's required.
absolutely. And we have plans to talk deeper about the actual emotions and the feelings involved in what we deal with and how we can overcome some of the, I guess we call imposter syndromes that are out there, that we have what it takes to do what we need to do to become leaders, and
Yeah,
to put that out there. So you all have what it takes. It
We
just,
do.
you need that motivation, and you need that compassion from people to help you in your path. So we're excited for the future. So Maya, what are you excited about coming this season? What would you like our audience to know about our upcoming season?
I think one of the things that I really would like to stress throughout this talk about leadership is that leadership is something that's earned.
Mhm.
It's a title, but at the end of the day, you earn leadership because someone trusts you with the right answer. And we're going to explore those different types of things as it relates to leadership and how it equates to trust. And when people trust you with the right answer, um, you have demonstrated 90% of leadership, because it's all about trust and the method of how you obtained that trust, whether it be regarding resources, whether it be regarding answers that are given. But again, it's about demonstrating trust and your ability to give the answer when needed and being trusted when needed.
I am so glad you brought that up, Maya, because guess what? Episode 2 next week, the title of the next episode is Building a Culture of Trust and Collaboration. So stay tuned, y'all, for season 3, episode 2. We'll talk to you next week. Thank you, everyone, for joining in. Of course, we always want you to think about compliance and everything you do, and think about that person that's affected with every decision you make in healthcare. So we encourage you to stay tuned, and thank you for listening. Thank you for supporting us here at the Healthcare Inspired Podcast. Until next time.